Tyrone Blind was in the Edmonton institution serving a 4-year, 9-month sentence for several offenses, including assault causing bodily harm, assault with a weapon, armed robbery, and drug trafficking. According to a September 2022 fatality inquiry into his death, he complained twice about severe gastrointestinal issues and told staff he was feeling suicidal about his condition. He was seen by a doctor and his medication was adjusted. According to the inquiry, 4 days later, he was put into a structured intervention unit for his safety. He was put back into his cell a day later. On January 31st, 2018, 3 days after returning to his cell, a guard doing rounds noticed that he had placed a towel covering the cell window, blocking his view of Tyrone. The guard tapped the door, and Tyrone replied that he was using the toilet. 15 minutes later, the guard opened the door and found Tyrone unresponsive. Another officer applied CPR. Emergency medical services arrived 35 minutes later. Tyrone died the next day in an Edmonton hospital. The inquiry found that a coordinated effort in the form of an multidisciplinary team meeting amongst all of Mr. Blind's care providers, including persons with case management and/or custodial duties, were not undertaken. Hence, the management of the pre-incident indicators, precipitating events, contributing risk factors, and the security intelligence information pertinent to Mr. Blind's risk for suicide and management thereof was at best fractured. Tyrone's family say they believe Tyrone did not receive the help he needed. Cherise is Tyrone's sister.
Yeah, mentally, yeah, I think there should have been, but there wasn't.
She says they feel he was not treated as a person with basic human rights.
They did a lot of wrong, like, even with his mental health, like, they just pushed that aside. Yeah, where that could, it could have been prevented.
Alira Blind is Tyrone's niece. She says workers did not see Tyrone as a person.
What happened to my uncle was a result of systemic racism and discrimination, and I just feel like mental health needs to be taken more serious.
The fatality report indicates that steps have been taken to prevent a suicide attempt in the future, such as not allowing views into cells to be obstructed and eliminating points of suspension to prevent suicide attempts.
I feel like those measures should have already been in place, and like this hasn't been the first time, and I want to do everything I can to prevent that happening to another family.
Correctional Services Canada responded to the recommendations in a public letter that said Health Services Management at the regional and site level will meet to ensure appropriate actions have been taken in response to the recommendations. Chris Stewart, APTN National News, Edmonton.